morning and welcome back. Well, if you're feeling fatigued, irritable, or have a fast heart rate, it may be underlying symptoms of a condition known as iron deficiency anemia. And Gunderson hematologist Lori Rosenstein is here to tell us a little bit more about the condition. Lori, thanks for joining us this morning.
Well, thanks for having me.
So we mentioned some of the symptoms there. How do you know at what point are these so bad that you should come in and have it checked out for iron deficiency anemia?
Yeah, well, it's a really hard question because one of the strongest symptoms is fatigue, and as we all know, all of us are fatigued. So that can be really difficult to know if that's iron deficiency or not. But my number one recommendation is just talk to your primary care provider about any symptoms you might be having. They can do screening labs and let us know if you're iron deficient or not.
Who are some people, some demographics of people that are maybe more iron deficient, maybe more susceptible? I know pregnant women as well need to watch their iron intakes pretty closely.
Absolutely. Certainly younger women and women of childbearing age are most at risk. But also older people. And one of the really important things to know is that iron deficiency can be a warning sign for colon cancer or colon polyps. So it's always something that we think about in older people, especially postmenopausal, to make sure that they don't have colon polyps or colon cancer.
So something to keep an eye on as a warning sign for that. But when you find out you have iron deficiency anemia, how do you treat it? What are some of the ways to cope with it?
Well, certainly I would recommend doing this under the guidance of a physician, but oral iron or pills of iron is one way that we can manage it. Unfortunately, pills of iron cause a lot of side effects, so a lot of my patients are having nausea or constipation from pills. And so I would just counsel people not to give up if the pills of iron make them feel poorly, because we have other ways of giving iron. We give a lot of intravenous iron, and that can be really, really helpful for a lot of people.
Yeah, something treatable. It's good to talk to your doctor about. Dr. Rosenstein, thanks for being here this morning. We appreciate it.
You're welcome. Thank you.
9 minutes before 7 a.m. We're back after this.